Hi, I'm Dr. Buonassisi. I'm a facial plastic surgeon here in Vancouver. I specialize in facial rejuvenation surgery and rhinoplasty. And today I'm going to talk a little bit about rhinoplasty in general. We probably have some other videos on our site that discuss this as well, but it's always a good thing to sort of refresh. There's always new ideas and new concepts that come up. And today I'd like to get into that a little bit as well. So rhinoplasty is really a surgery that is designed to change the shape of the nose. Sometimes it's used to help the function of the nose and in order to breathe better, but for the most part, we're using it to change the way the nose looks and improve probably the balance of the face overall for individual patients. There are things that rhinoplasty can change about the nose, and there are things that it can't. For example, you can't really change the skin on someone's nose, so if you've got thick skin, that determines to a certain extent what your nose will look like. But the underlying structures can be reduced. There's lots of different ways of doing that, and today I was going to talk about a technique that I use that has recently been termed preservation rhinoplasty, but is something that has been around for a long time. So preservation rhinoplasty really refers to a technique that is used to bring the height of the bridge down. It has nothing to do with where the tip is or how the tip is modified. It's not analogous to a closed rhinoplasty or an open rhinoplasty. Those are sort of different approaches to the nose that we use. But a preservation rhinoplasty essentially is a technique that is used to lower the bridge of the nose without actually reducing the bridge on its superficial surface. So essentially what it does is it drops the bridge of the nose down from inside. So rather than shaving it down or cutting it off, we actually take the base of the nose on the inside and we allow that septum and nasal wall to be shortened so that the bridge itself lowers. Think about the top of your nose as if this is the surface. And let's say that surface of your nose is higher than you want, but you like the shape. Then instead of cutting that off in order to lower the bridge can be lowered by dropping it down from inside. So that bridge can be lowered, but not change that dimension or not change that feature. So it's basically taking this base support of the bridge, which is the nasal septum in the midline and the nasal walls on the sides, and making those shorter, removing a bit of bone and removing a bit of septum so that the bridge of the nose slides down the way this tripod slides down. Now, if the top of your nose is irregular and you don't like the shape of it, let's say it has some edges that stick out a little bit, then lowering that whole thing doesn't really solve the problem of the shape being not what you want. So in a case where the shape of the nose on front view or the shape of the side walls of the nose at the very top are not what a patient wants, I'll show you an example of that. Probably not the technique to use, because then we're dropping down the nose and making it lower, but not improving the shape or the feel of the nose on the top. So those are kind of the main principles. So it's really a technique that is used as part of a rhinoplasty. So if I'm making a change to someone's tip, like tilting it up or bringing it in or refining the shape of the tip, that's a completely separate part of the rhinoplasty. In a case like that where I'm making modifications to the tip, I might bring the bridge down with a preservation technique, or I might take the bridge down with a more traditional technique where we remove the height of the bridge by taking it down with rasps or chisels or saws. So those are kind of the principles behind that. So what would be a case where we might use a preservation technique for the bridge reduction? I think the perfect scenario is someone who has a really nice nose on front view, but on their side view has maybe a gentle curve or a slight hump that they don't love. Cases like that, I think if you can maintain the relationships, and that's why we call it preservation, we're preserving the attachments and we're preserving the arch that's formed on the bridge of the nose. If we can preserve that and just lower the whole thing a little bit, it has much less of an impact on what the bridge looks like on the front view. If we're removing the bridge in the more traditional way, then it will change the way the bridge looks to a certain extent on the front view. So those are kind of the things to think about. Cases where I wouldn't generally recommend using a preservation technique are cases where there's irregularity. So sometimes there's these little spicules of bone that protrude called Rhinoplasty horns. Someone's got very prominent Rhinoplasty horns. Bringing that whole bridge down, but still having the horns, doesn't really make sense. So I think in a case like that, we would want to use a more traditional technique. Also in cases where the bridge is really high and there's a really substantial hump reduction that's required, I don't think it's possible to remove enough of the bone or enough of the septum on the inside to get the whole thing to lower it enough. And in cases like that, you could potentially use both techniques, but probably I would use a more traditional excisional technique where we're reducing the bridge height from above and lowering it downwards from top to bottom. Now keep in mind, although the technique we were just discussing is called preservation rhinoplasty, there are ways with a traditional technique to really reconstruct and rebuild those attachments and those contours so that you really get a nice result either way. And so I think this is something that I've had some patients ask me about, and it's a technique that I use probably in 20 or 30% of cases. I think it works great, and I think if you can keep the shape of the nose and sometimes not even have to lift the skin off of the bridge, it's a really nice and very gentle way of bringing the bridge down. I think it works great. But there's lots of cases as well where I don't think it's really the ideal technique for this. So if you're thinking about having rhinoplasty and you're thinking that, oh, maybe a preservation technique is a way to go, ask your surgeon about it, see what he or she thinks about in terms of whether you're going to get the best possible result that way, what are the limitations.